Yeah, good afternoon. Oh, thanks, Julie. Good afternoon, everybody. It's 12. It's officially afternoon. I had to check that real quick. Thanks everyone for attending today. My name's Stephanie Hall. I'm the Director of Planning and Advocacy at Ageways. I want to thank all of our attendees and especially our legislators for taking the time out to attend this today. We hope that this is beneficial for both the individuals who are attending as well as all of our legislators and just moving the conversation forward on the importance of supporting programming for older adults, adults with disabilities, and caregivers. We really hope events like this help facilitate communication between constituents in our region as well as the legislators that oversee them. So the hope is that legislators on the call today will be able to share how they're supporting older adults, and attendees feel encouraged in speaking to their legislators and hopefully following this able to speak more openly with them. So, just a brief explanation of who we are as Ageways. So, we are Ageways Nonprofit Senior Services, formerly the Area Agency on Aging 1B. We serve 6 counties in Southeast Michigan. Those are Monroe, Washtenaw, Livingston, Oakland, Macomb, and St. Clair. So we were established in the early 1970s, and we have a strong history of supporting older adults, people with disabilities, as well as family caregivers in Southeast Michigan. And we are one of 16 area agencies on aging in the state and one of more than 600 in the country. So, as an area agency on aging, we help people access the services and programs they need to remain living independently and with dignity in their own home or with family caregivers. We provide direct care programs for seniors, along with funding and support for many programs provided in partnership with our great community partners. So, as an area agency on aging, one of the really cool things is we are charged with advocating on behalf of those that we serve. So, including these include a variety of things like informing our state and federal legislature on the needs of those that we serve, as well as supports for programs and services for those populations. We also do things like this where we try to connect individuals in our area with their legislators. So again, I just want to thank everyone for taking the time out today for and attending this call. Pass it over to
All
Jeff.
right. Thank you so much, Stephanie. So couple of quick housekeeping rules. We're couple all participants are going to be on mute out of respect for our legislators. Please submit all of the questions via the chat. We also will go through some of the pre-submitted questions that you did put in via the registration, and we will be monitoring those. This session is being recorded and will be shared after the event. And when you are submitting a question in the chat, please include your name, organization, and who you serve if possible. So real quick, I want to frame the conversation and just kind of open, and then I will introduce our legislators. So here in Southeast Michigan, more people are aging alone and without enough care. And without action, waiting lists are going to grow and families are left scrambling. Michigan currently spends only 3% of its Medicaid long-term care dollars on home and community-based services, far below the national average. And that means fewer resources for services like in-home care, adult day programs, or respite, and more pressure on our nursing facilities, caregivers, and our workforce. Our legislative platform for Ageways is to strengthen the My Choice program, improve pay, training, and retention for the direct care workforce, as well as increase access to non-Medicaid services like transportation, home delivered meals, support unpaid family caregivers, kinship caregivers as well, and then also expand aging friendly housing. We are here today to discuss how legislation and leadership can support older adults and adults with disabilities and caregivers throughout Southeast Michigan. And I'm very grateful to be joined by a lot of our legislators here. So I would like to introduce them one by one. And then they have about 2 to 3 minutes to kind of just talk to you all. So we will start it off with Senator Jeff Irwin. He represents Michigan's 15th Senate District, which includes communities like Washtenaw, Leland, I cannot pronounce that, I apologize, and Monroe counties, including Ann Arbor, Ypsi, Saline, Milan, and Clinton. He is a longtime advocate for equity and public health. Senator Irwin, please take it away.
Thank you very much. It's always a pleasure to work with Ageways on these important issues and to represent the communities of Washtenaw, Lenawee, and Monroe counties, and communities like Saline and Milan. Sometimes it's fun to pronounce Michigan cities, and so all right, a couple of things I'll focus on. There's so many things we could talk about. There's a rich area, but I'll just focus on two things. One of the things that has been a top budget priority for me for many, many years, we've made limited progress, but we need to make a lot more progress, is on making sure that we protect home and community-based services. In particular, we make it very, very hard for people to get home help. We know that people are going to be happier and healthier and are going to live longer. Most people would choose to stay at home and age in place rather than go to a nursing home. But the way that we compensate in-home caregivers is so pitiful. It's so criminally low that people often don't have access to those services, even if they get rated to receive those services. We're paying these caregivers such a criminally low rate that they're in poverty. Nobody stays in the profession. Anyone can make more money in any other entry level job. And as a result, we're treating our seniors and our disabled residents who need these services terribly. So that's something that's absolutely at the top of my list for budget time every year I've been in the Senate. And we need to make progress again this year on direct care worker workforce and wages if we want to really serve our seniors the way that we need to. The other thing I'll mention is more of a policy issue rather than a budget issue, and that is around guardianships and conservatorships. There's been a lot of effort over years. The Attorney General had a task force and has developed some legislation around that, and I'm really focused on a few elements within that legislation to improve our system of guardianships and conservatorships to make sure that we protect people against exploitation. One, I think that if the judge is going to deviate from a family member and give guardianship to a professional guardian, that they should have to go on the record and say why. The law says that the judges are supposed to give family members first crack. Sometimes that family member might not be the right person for reasons, but those reasons should be stated on the record. I think that would be one way we could curtail some of the abuse that we're seeing. Also, I think that when someone's real property, when someone's home is being sold and they're under guardianship, there has to be an appraisal. Right now, these homes are being sold without appraisals, which I think leads to a lot of exploitation as well. And similarly, I think that when someone is appointed a guardian, there has to be an inventory of their assets. Right now, we only require that for people who are assigned a conservator, so people who have more money. Well, people who have less money need to have their assets protected as well. And so those are just a couple things I'm working on in this space, and really appreciate your time. Thanks.
Thank you so much. And now I'm going to turn it over to Senator Kavanagh. She serves Michigan's sixth Senate district, covering portions of Wayne County and Oakland County. Her districts include Northwest Detroit, Redford, Livonia, Farmington Hills, and Farmington. And she brings a strong focus on working families, education, and infrastructure. Welcome, Senator Kavanagh.
Thank you so much for having me. And also thank you for facilitating this important conversation and all those that are joining. As you heard, my name is Mary Kavanagh. I am the state senator for Michigan's 6th Senate district. So that includes, like we heard, Northwest Detroit, but that's from 7 Mile to Greenfield down to 96, all the way to Telegraph. All of Redford Township, a good portion of Livonia, all of Farmington, and the southern portion of Farmington Hills. And I serve on about 9 committees, chair about 3 budget and 1 policy. I'm also the Legislative Latino Caucus chair and the youngest woman to ever serve in the Michigan State Senate. So want to bring all of that just because I want to bring my experience. And actually, prior to serving in the legislature, I actually was a direct care worker for those mentally and physically disabled. And so I'm carrying that into my service, and a lot of what Senator Irwin talked about is a lot of what we're championing as well, and making sure that we're actually giving affordable wages, but also making sure that we're doing family first. We've seen a lot of data, regardless if it's insurance avenue or if it's a little bit making sure that we're sending resources into the community and also paying those that want to take care of their family members. The data proves that's a lot better for our communities. Just wanted to, while taking this time, note on some things that I have been able to do. And I just wanted to make sure that everyone knew this, because this is laws that are going into effect or have gone into effect in the last year or so. We were able to put across the veterans property tax exemption. So that's property tax filing burdening about 100% disabled veterans. They had to file every year. This is going to be a one and done, and we also extended it to surviving spouses. Repealing the retirement tax, and also a little bit what I'm looking forward to continuing, and especially we just started a new legislative session this past January, supporting our families in worker compensation reform, veteran support. We're seeing a lot of homeless veterans. We're also seeing a lot of lack of resources in that area. And regardless of what happens in the federal government, we are seeing an uptick of the need of not only PTS or mental health and behavioral health for our veterans, but also in our communities. Family-based supports to age in place, as well as I'm the chair of LEO that oversees MISHTA. It is very important to me to focus on housing and carving out dollars for housing that's accessible to individuals, for people to age in place, incentives that also help seniors or even developers build those kind of accessible housing, as well as ADA support, not only for homes, but also businesses. I really think community members, no matter who, can need to be able to participate in the things that the state has to offer. I also sit on DHHS, and I mentioned that because this has been a long drive for me while I've been in the Senate on just community mental health and behavioral mental health, and also bringing down the cost of living from our housing, groceries, car insurance, lowering prescription drugs, as we are actually seeing an uptick of and people not taking their prescription drugs because of the affordability. And lastly, a big thing of mine is corporate accountability. So when we talk about transparency in our health insurance, our auto insurance, we talk about price gouging, fraud that we're seeing through data. I sit as chair of finance, insurance, and consumer protection. So those are a lot of issues that I really want to curb, especially for our seniors and for our young people, and all of this new data that's coming out of AI and protecting our seniors and robocalls. We are working on the budget, so don't want to get too much into that. But did want to mention that the Senate just introduced legislation this week that implements a silver alert system in Michigan. It's similar to Amber Alert, but this system would help find missing elderly individuals lost or confused. And we're seeing it get a little bit lost in the system of Amber Alerts. So we really want to hold those two just as important. And also I sit on LARA, License and Regulatory Affairs, and wanted to bring that up because I really find it important to have oversight and as well as care facilities, making sure that we're advocating for them. So there's a bit of transparency in reporting, surveyors, and oversight in our Michigan nursing home that I'm fighting for on that budget side. So I appreciate the time and excited for the conversation.
Thank you so much. Next, I would like to introduce Representative Wozniak. He represents the 59th House District in Macomb County, serving Shelby Township and parts of Macomb Township. If I remember correctly, he is an elder law or was an elder law practicing attorney. I don't know if he's and has a deep understanding of guardianship and probate and aging issues, and has been a really strong supporter of Ageways. Welcome, Representative Wozniak.
Thank you. I really appreciate this opportunity to communicate with you. And a little bit about my history. I've been an attorney for 27 years. I've been involved with the probate and estate planning sections of the state bar. I was one of the first certificate receivers of the probate and elder law certification back in, I think it was 2001, 2002. And that program has expanded tremendously. I've always been interested in senior events, and rather than repeating what Senator Irwin and Senator Kavanagh talked about, I'm deeply involved with all the issues that they've mentioned already. So rather than repeat that, I am currently on the Families and Veterans Committee, overseeing all the issues that we can look at for families, including seniors and veterans that are out there, particularly the homeless veterans and the veterans that are under tribal law, because we have many indigenous people that join the military and are veterans. We have to make sure we take care of them. I would say that the silver alert that we're putting out is utilized by many other states. I think it's important to make sure that this goes forward. with regard to TRICARE for veterans. We're putting in exemptions for those veterans that utilize TRICARE and will have dental care covered, and that's a bill we've got up right now. I would like to say that I'm encouraged by the PACE, one of your sister organizations, I would call it, that I also am encouraged by the product they put out, the work that they do, and the increases in the income and asset allowances so that we can put more people on that. One thing I would try and do is look at the unionization of, and I oppose it, and I opposed it at the time, of home care workers and the dues that they have to pay into a union. It's almost like what I would call a skim off their wages, where that money should go back into their pockets. I've also been a member of the Elder Abuse Task Force for the last 4 years. And as mentioned, there are many bills that are coming forward to look at priorities of appointment for people that care for elders, rather than going right to a professional guardian. One of the things I've seen is that there is different types of issues that come forward throughout our state from the judicial system, and it is inconsistent with what we have intended. So we need more education in the judiciary to take care of our elders. I worked with SMART with regard to same day pickup, last mile, I call it, so that elders can get to their doctor appointments, to wherever they have to go from their door, and not just have to try and get to a SMART location. That is in progress right now. I'm really encouraged by that program, and it seems to be working quite well. Also have a couple of other bills that are in process with regard to care contracts. Right now, DHHS requires notarization of care contracts at the inception. That is almost impossible to look at the beginning of a care period. So we're trying to eliminate the notarization requirement, and I will be introducing a bill for that. One thing I've always liked about Ageways, the Area Agency on Aging, is they are a very prolific travel agent, I would call them, or navigator for seniors. During my time when I was active as an attorney, I've always contacted Ageways to make sure that we had that navigation tool in the hands of our seniors so that they could utilize everything that you guys offer. I think you're underpublicized for the work you do quite a bit. And I would hope in the future we can get the information out there that you provide for seniors and continue all of the information to go to those seniors so they know what they can do. I did touch on the guardianship issue. As I've said, for the last 4 years, the Elder Abuse Task Force has been working on those issues. We have product coming out. Some of it's out already, but we've also got partner bills that talk about kinship and other types of representation available to seniors rather than just appointing a commercial guardian. That's about all I have to say right now.
Thank you so much. Also joining us today is Representative Stackloff, and she represents the 19th House District in Oakland County, which includes portions of Farmington Hills, Birmingham, Beverly Hills, Franklin, Southfield, and surrounding communities. She is a leader on healthcare and mental health access and has been a vocal advocate for policies that support caregivers and strengthen home and community-based services. So welcome, Representative Stackloff.
Thank you, and thank you all for having us here today for this important conversation. I'm Samantha Stackloff, represent the 19th District. I'm in my third term in the legislature. I serve the communities of Farmington Hills, Southfield, Bingham Farms, Beverly Hills, Franklin, Bloomfield, the village of Bloomfield, and Birmingham. So it kind of stretches along Oakland County. Previously, before heading into the state legislature, I served on Farmington Hills City Council for 7 years. And one of the things really being dedicated to was making sure that our seniors had an opportunity to live in their own home, age in place. And we had a very, very active Commission on Aging that continues to grow and flourish in the cities of Farmington Hills. In my district alone, we are going to see an increase about 50% of our seniors by the years 2045. So particularly where I come into this kind of equation is I work on the workforce development side. I'm the former chair of higher education and community colleges in the House Budget Committee. So one of the things I really worked on is making sure that we have a workforce that can meet the needs of our seniors. Now, we're currently not meeting those needs, not even close. And it's a huge problem. So what we've been able to do in the higher education space is offer free community college. So anyone could get a community college degree. They can take courses to help get the necessary requirements to become a caregiver. That's really important. We also have Michigan Reconnect that allows people to go back to school who don't necessarily have those credentials so they can get them more easily. And both of these programs are covered by the state of Michigan. So that's really what I kind of, bring to the table in this conversation is really strengthening our workforce development. I am a cancer survivor, so when it comes to a lot of the healthcare things that I particularly work on, making sure that our young and our old have the necessary screenings, have health insurance that can cover the cost of those needs. For the past 15 years, we've been trying to get oral chemo parity into state law in the state of Michigan. We're now the 43rd state to enter that program. So now those of you who unfortunately are going through a cancer diagnosis or treatment, this will allow you to kind of live quality of life where you're no longer going in for infusions, that you can stay with your family by just taking an oral pill daily. So that's a little bit about me. And again, thank you for having us.
Thank you so much. And lastly, and she just joined, I just saw, so I'm going to actually get her pinned over here too, so you all can see her face as well. We have Representative Schmaltz on the line with us as well. She serves the 49th House District, which spans parts of Jackson and Washtenaw counties, including communities such as Jackson, Chelsea, Blackman Township, and Sylvan Township. With a background in broadcasting and community services, Representative Schmaltz is focused on improving quality of life for seniors, veterans, and families across her district. So welcome. And I'm glad you were finally able to get some of those tech issues solved.
Yes, I've been on. I just haven't. I called in at first because I couldn't get the video on, but we're here. Yes, I've been listening the whole time, and a lot of the issues have already come up. It's the 46th district, which includes Jackson and Chelsea and the areas that you said. I am chair of Families and Veterans, and of course, all these issues are very important to me. And many of the senators and representatives already brought up these issues, but I do have a guardianship package that we're bringing forward, and this would make sure that our licensed professional guardians are licensed. That's really important. And this is to help with abuse issues and to make sure that they have background checks and that these professional guardians are the right people to be taking care of our seniors. So we're going to be introducing this a 3-bill package. I've also been working with AARP. They would like a tax credit for family caregivers up to a maximum of $3,000 a year. So we are working on that one. We hope to, we have some more meetings with them to try and get that going. I also introduced last year, and we're working on that again, it's a tax credit for any renovations in your home for people 65 and older. If you're going to put in like a bath bar or a ramp, or if somebody helps you put that in, they can get a tax credit of $500. We talked about the Silver Alert bills already, and we did pass that out of my committee unanimously, so that should go to the House floor. Again, it's just like the Amber Alert bill. There are 37 other states that have the Silver Alert, and of course, with our aging population, it's very important that we make sure that we can find our seniors, especially those with dementia and Alzheimer's, those who wander away and we can't find them. We want to make sure that we are alerted on our phones and television and anywhere we can before any tragedy happens to them. That's really important. For our veterans, we're working on, I have a hyperbaric oxygen treatment for them. Other states have shown that it helps with PTSD and traumatic brain injuries. So we're working on that. We're waiting for safety guidelines to come through from the international organization to make sure that everything is good with that. And we will introduce that bill. Always looking for affordable housing for our veterans and our seniors. That's really important. That's always on the list. Priority two is we have Wellwise here and we have Tomei Pace. And I know it's really important. We always want to prioritize keeping seniors in their homes. And Pace also helps with that by letting seniors go to Pace for the whole day and they can still stay in their homes and they have social interactions and they can get meals there. So that's really important. We have a lot of great community organizations in my area which help seniors in different areas. So they're able to stay in their homes. And I said Wellwise is another Region 2 aging agency who also helps so much with that. So we're very fortunate to have all that in our area. We also have Center for Family Health, which also helps in many areas with seniors, veterans, and the like. One thing in the health department the health committee that I'm on that we always work on and we're doing more of is compacts. So occupational health, physical therapists, people can be working across state lines and they don't have to get extra licenses. This will help improve accessibility and help more people get the health care that they need. Those are just some of the things we're working on.
Well, thank you so much. And thank you guys all for joining us today. So for this next section, we are going to go into a Q&A session where I will ask you guys some questions. Please come off mute and please feel free to share any of your comments or concerns for our legislators only. And for everyone else, please stay on mute. You can put them into the chat. I do want to quickly mention we did receive a lot of questions regarding some of our federal policies. This is a state conversation with our state legislators, and later on this summer, the Ageways will be hosting a federal policy conversation. So we will be trying to keep all of these questions to state policy focused only. So the first question that I have for our legislators here today is, I care for our loved ones who have dementia. How can Michigan invest in helping caregivers with case management and navigating transitions from home to assisted living or memory care? Would any of our legislators like to come off mute and comment?
Well, am I off? Let's see.
Yep, you're off mute.
Yeah. We have, like I talked about before, in our community, we have a lot of different local agencies that help deal with that. Again, I talked about PACE, I talked about Wellwise. I think that's a lot of local agencies take up. We also have 211 where you can call to get help with that. So really, it's a community effort, I think. And like I said, we're so fortunate to have so many here, Family Services and Children's Aid, and different places that will help. And of course, with transportation, which is a hard thing too for our seniors and veterans. We have WAVE, of course, in Washington, Jackson, and they've offered even more routes in the evening. And then we also have the transportation authorities that help too. So mainly, I look at our community organizations close to home to help deal with that.
There's been a discussion for several years about the state of Michigan stepping up more in this regard. What I've seen from other states is that other states tend to have, from what I can tell, a more robust effort around memory care issues, dementia, Alzheimer's, all the above. I think it was last year, it may have been 2 years ago, but just recently we just finally started putting money into the budget. Last year it was $400,000 to develop a dementia focused unit at MDHHS. So that work has really just started, and I think that's been a small amount of progress we've seen in the last couple of years. But I think the context that we're operating in is that Michigan's not doing enough to help those local organizations that were just mentioned and to organize, that work in the state and make sure that it's most efficient and most effective.
And if I just want to piggyback off that is first and foremost, the state isn't doing enough. And we're also seeing a lot of people leaving the state to try to get some of these services. And it's the question that you guys put in the chat. So just to make sure to invest in helping caregivers with case management. I think these are a couple different avenues that we're kind of attacking. It's from community, yes, because it's a lot of things that that the representative mentioned, but also disability networks, not only health disabilities, but those that are experiencing that, but it's also education to figure out the things that you are experiencing, pinpointing what that is. And so definitely the caregivers, there's not enough people in that space. And so that over pressure and also over knowledge of casework isn't being the management, and people aren't going into it. So we're not enabling the state to be a champion in that. So I do think some of the things that we mentioned in our intros to try to show those support, not only helping people get in there, but also making sure that they're not doing 3 times the jobs. And navigating transition from home to assisted living to memory care. There's so much more we're not doing in memory care. And I know the senator just mentioned a little bit more of investments that we're making, which is great. But I do think Michigan isn't doing much, and we need to do more, especially when it comes to memory care and how many of those in those areas. The data proves that if we actually wrap our arms around them, do a community, and also do supports, that it's not as severe of the symptoms and as rapid. And so I'd love to see us do more, but navigating transition from home. I really wanted to talk a little bit about being the Leo chair and serving a little bit before my as a direct care worker. Is I really saw that seniors that wanted to leave didn't have that choice, didn't have that stepping stone, but also didn't have that housing market, but also seniors that wanted to stay in their homes, whether it be eviction, diversion, or it's a home repair that they used to be able to do, but now can't, and it severely affects the rest of their lives. So I think we're really doubling down on making sure that seniors have both of those supports, whether it be staying in their home or incentivizing the new builds of communities that they can actually age into. I do think it also has a lot to do with transportation to get to your communities. People that want to age in their home don't have access to their pharmacy and their grocery store, even without a car. So I do think that there's multiple avenues that we are attacking, but it can do more. And I think that not even focusing on the memory care, doing more services as people age will eventually do that memory care, as well as investing into those studies and those wraparound services for that. So I just wanted to add that a little bit. And yeah, thank you.
One thing I could add too, there's something that's called the Davies Project, which I have a request in for the budget, and they're located in AM County right now, and they want to expand throughout the state, but they help with transportation. It's all people helping seniors to get to appointments they need to get to. You were talking about that, and that's such a great organization. And I know here at Henry Ford Hospital, I was on the foundation board here for quite some time. We also have transportation for patients too. So the more we can expand that will really help that area.
Thank you guys all very much for those comments. So the next question that we have is, how can Michigan work with insurance providers to increase coverage for in-home services? And what steps could you do to support the need for reduced wait lists for in-home care, transportation, and nutrition services? And I'll also put that question in the chat for you guys.
Well, I can start with that because I really been at odds with some of the insurance policies that we have in the state, and we're working on trying to change those. It's almost like the company will say, you don't qualify, prove that you qualify for this benefit. And then when you look into prior approval, that slows down that whole process. I'd like to see if we can eliminate the prior approvals for elders, particularly trying to get care for so they can stay in the home. You know, insurance companies just look at their profit and loss a lot of times rather than trying to take care of the individual. So when we look at that, I think it's important that we as legislators look at the insurance policy that we have in this state and try and change it. I agree. Michigan's been lax at working on that. And that might be because the insurance companies like to push legislators in one direction, legislators in one direction or the other. Uh, there was a time too that DHHS, and I'm going back probably a couple decades, had the same attitude that any applicant to Medicaid, whether they were a senior or anyone else, didn't qualify. That was their idea, that the person that was applying didn't qualify and they had to go beyond just proving that they could qualify to actually get in the approval from DHHS to get on the program. Now that's changed, and I think that's a wonderful change. And I think Director Hertel is doing her best to keep DHHS on progress for that in particular. Now there's other issues that we've gone to head with that, and I'm talking about the legal sections that we've got, particularly the probate section, that have had issues with DHHS where they have promised to do things but not have followed through. I'm seeing a great change in that where we're getting cooperation, and I think that the constituents that we have are going to benefit from that change in DHHS.
I would add to that a few years ago, the state invested several $1 million in something called the SIM project, state implementation something, SIM. And what these were is it was regional groups that were analyzing how would it affect long-term healthcare costs if we invested in community health workers and we attended to social determinants of health. Would we get more people to come to their appointments? Would we reduce long-term costs? Would we reduce needs for hospitalization? Basically, what they found is exactly what we all know they'd find, which is that if you invest in some of these things, invest in home and community-based care, you actually reduce long-term costs. Here's the problem, though. As we try to encourage the health insurance companies to invest in those things and point out to them that if you invest in these services, it actually reduces the long-term cost of healthcare. So therefore, presumably, there's a financial interest on behalf of the healthcare industry to do this. The healthcare industry doesn't do it. And the reason they don't do it is because of the rampant market failure we have in health insurance. Health insurance shouldn't be a private market. If you're a health insurance company and you invest in your customers, patients, ratepayers to help them reduce their long-term costs, you might not be their insurer in 5 or 10 or 20 years. If you're not their insurer when they incur those long-term costs, then you don't get the benefit. You only get the costs. So these insurance companies are trying to game the system. They're trying to make as much money as possible because that's what corporations exist to do. And the fact that it saves money over the lifetime isn't important to them unless they know that they're going to have that insured person over the lifetime. This is why we need one insurance policy for the entire country, because that's what works to try to actually make sure that the cost of the system and the long-term benefits of investing in preventative care are actually realized. The way we do it here in America is foolhardy, and it ends up costing the most and getting the worst results.
Thank you so much. I real quick want to jump to a question since there was that caregiver contract bill that was overwhelmingly passed in the Senate. And for our state, for our House representatives here, what do you think the prospects of that moving in the House? Family caregivers often find themselves in a trap and if they're making efforts to keep loved ones at home and being paid to do so. So what do you guys think about the that bill being moved into the House and through the House?
Are you talking about Senator Cherry's bill 266?
Yes.
Yeah, it's just a couple days ago, I was asked to sponsor that bill in the House with the exact same wording. And again, I mentioned it previously, it had required any applicant to Medicaid to have their care contract notarized. And if it wasn't notarized, then it would get not approved. So hopefully we can change that. That it was a, if I can use the word silly, it was a silly rule to begin with. It's an overreach by DHHS, and hopefully we'll get it through the House.
And as I mentioned before, I'm working with AARP on tax credit for family caregivers. So we're hoping to bring relief there to help them out in that area.
Thank you, guys. The next question that I wanted to ask was on the My Choice program, and I'm actually going to turn it over to Stephanie Hall, to ask that question, given that she is very much works more closely within that program than I do.
Yeah, it's kind of going back in line with what we were talking about previously about the importance of supporting home and community-based services. Obviously, we had a few questions about the My Choice program, which is our Medicaid program for home and community-based services and additional support there. Knowing, following the conversation we just had, that many people are not able to receive those home and community-based services through their private insurance or through things like Medicare. What are some ways that the legislature is working to support more of those individuals through those Medicaid in-home service programs? And, how can we do better in the future?
I would just reiterate what Senator Irwin mentioned, that we have some impetus, I would say, to get more of those services going. And particularly Macomb, our services are strong with Meals on Wheels and SMART. Those two things I think really affect seniors. Going forward, I think we can improve what we're doing with those two things. And as Senator Irwin did mention, hopefully we can expand that. Now, I think we have to depend upon Ageways to make sure that they can help those seniors navigate, to know that those programs are available to them. And that's where I've always saw, even in my practice, I found that seniors would get confused, they'd get afraid, and then when a senior gets afraid of doing something, they do nothing. And that is very harmful.
Yeah, I think that's really important, just letting our seniors know the resources that are out there, educate them with that. And we have great programs too, like the Meals on Wheels, like Representative Wozniak was talking about. We can always use more services, and with our aging population, we're going to have to find ways to find more healthcare workers. First of all, that's a big issue we're facing right now. And we're always trying to get to our young people early in middle school, even to get them on a path, whether it's CTE, whether it's healthcare, to make sure we have healthcare workers in the future. That's really important. But yes, we're going to have to do more to expand our services. But education is a big thing, letting seniors know what's out there, because a lot of them don't know what's out there to help them.
And I want
Building
to,
off, go ahead, Mary.
oh, thanks. I just wanted to add that all of that, yes, especially being a legislator, I come a little bit from grassroots, and just the importance of us being a little bit of like precinct delegates of all of the great things that we do in Lansing, and all of the programs might not be known in our community, or the resources might not be available to people that know they can access that. And I know Ageways and others are doing what they can, but I think it's also on to us to either host either health events or even make those connections. But I did want to just note that in health, the home and community-based services is, I think Michigan currently provides over $3 billion in Medicaid funding per year to housing, nursing homes and home and community-based services. And more than about 1.5 billion in Medicaid dollars each year. So I know that sounds like a lot, but I do think that we're not doing enough, and it's not only putting more money in there, but I think it's based off what all of the other legislators and Senator Irwin was touching on, is changing this narrative of this individualistic idea of aging. And regardless if you have that family, it's really incentivizing that community and making sure that if you wanted to age in place, you have that community, and it's not someone that has to take 3 jobs, or it's not unattainable. And I also think this is combating that insurance agents, combating those prescription drugs, because I think that is a huge narrative that is in Lansing or politics that kind of diverge us from kind of going to that community-based services and doubling down there. So I do think that we are committed in the legislature to also fund those community centers, those senior centers and local programs like health and healing centers, and also some Meals on Wheels and other things that really help the community. But I do think we can be doing more. But I also think it's individuals, not only the stakeholders, people on this call, but everyone in Lansing kind of changing that narrative that an individual needs to be alone and needs to go straight into a nursing home, especially if we don't have those kind of resources. And I think we saw in the chat, it could be a lot cheaper with those preventative and also aging at home or providing those resources to those seniors at the house. And I think that's just the direction we need to continue to go down.
Yeah, I was just going
Thank
to
you.
say the impolite thing, which is that we need more money in the budget in home and community-based services. And someone just pointed out in the chat that there's, some conflict within the DHHS budget between, does the state put more of its effort and resources into supporting nursing homes and making sure that, those opportunities are available to people, or do we put more money and resources into providing home and community-based services? Those things are naturally in some sort of conflict because they're in that same budget. And I think that we need to be pushing more for the services that people want, the services that keep them happier and healthier for longer, the services that cost less. And Michigan has a history of leaning more towards nursing home funding than home and community-based services. But it goes deeper than that. What's really happening right now in Lansing is that even though a lot of legislators, when you talk to them, will say, I support home and community services, I support direct care workers, when it comes down to the bottom line, even though we all support it, and even though every dollar we put into this brings 2 more federal dollars to invest in our communities, there's also a lot of people who want to spend money on roads or other priorities. And so, in the budget conversation, when your legislators are trying to fight for resources for these different priorities, I would just encourage everyone to communicate with their legislators about how important this is and how it ranks on their list of priorities. Because right now, roads is sucking up every available dollar in Lansing, even though those dollars, I think, are more needed to fill the potholes in our human services system. And even though when we put a dollar into the human service pothole, it brings 2 federal dollars with it.
Julie, you're muted.
Sorry about that. Thank you guys for sharing all of that. Real quick, I just want to, Representative Stackloff did have to jump off. She had another commitment, but we do thank her for her willingness to be here. And now I'm going to jump to the next question that we have. Safety and oversight are critical in regards to medication administration and skilled nursing care. What is the status of Teresa's Law in each of your various chambers? And how will you prioritize improving professional training and quality of care in adult foster care system?
Of course, Stephanie Young is working on that, and I hear it's still in the works and should be coming up pretty soon. I there's so much more that needs to be done with this. I took care of both of my elderly parents, and of course, my mom was in one nursing home, and it doesn't matter how great the nursing home is, how expensive it is. We don't have properly trained people taking care of people in there. My mom was given medication that she shouldn't have been given. She didn't get up and around like she should have been. So there are a lot of problems, and we need more regulations there. We need to make sure that everybody is trained who are dealing with these seniors. It's just wrong that we put them in this situation. So I'm looking forward to Teresa's Law to read it and see what's in there, but we have to do a lot more.
Thank you very much. Does anyone else have any comments they would like to put on Teresa's Law? What about from the Senate side?
Yep, I'd have to double check where it is in the process, at least at this time. I do know I am talking to the representative over on the House side as they work through that. I know Representative Young is my representative. And so we're talking about it, but it's also very, very important. I actually went through this before I served in the legislature. I was a direct care worker and kind of saw some of the things that were happening and also the dangerousness of things that are happening because of this law. But I do think that this is something that we need to take into consideration as we urge what Senator Irwin was saying was this being a priority, especially the pay. We're going to require them to do more and also learn more. And because it is very, very important to the people that they serve, I also want to make sure that the people that are going into that area aren't not going to go into that area because of the higher qualifications and still the very, very low pay that they're going to experience. So I do want a both and and situation. There needs to be more oversight. There needs to be more transparency and also more education and enforcement in that area. But I also don't want to have anybody that's looking to go into that field be a little bit less likely because of more qualifications, or at least feel that they're not going to be supported.
Thank you. So the next thing I kind of want to transition to, and it's actually an issue that's kind of near and dear personally to my heart, is affordable housing and housing issues, especially with regards to our senior citizens. Because if we don't have affordable housing for them to be able to age within the homes of within the communities of their choice, then they will have to end up in a nursing home, and those beds are already unfortunately overflowing. So what legislative efforts are underway to expand affordable, accessible housing options for older adults? Older adults may want to downsize or move closer to families or their respective caregivers, yet remain homeowners. And can Michigan consider an exemption for property tax increases for senior citizens?
So, I mean, this is a huge issue. We could spend a whole hour just talking about this. I'll just mention one or two things. One, uh, you know, I think we need to just invest more in specifically, you know, walkable, more urban senior living communities that are attractive. It's a huge opportunity to meet people's needs here in Michigan, and I think Michigan should be more focused on that. You know, there's some opportunities in my communities that I'm trying to work with local governments on realizing, you know, to you know, put some units in that are appropriate for seniors, but that are also not just appropriate within the units, but are located in places where, you know, they have access to what they need and maybe don't have to drive to get where they need to go every day. You know, so that's a big piece of it. And you know, I also think we need to be thinking about land use generally and making our communities more, you know, the kind of communities where people can age in place.
Yeah, I agree with Senator Irwin on that. And also, I look at let's put more money in seniors' pockets. Let's take taxes off of seniors' retirement and pensions and Social Security. We could also help in that way, too.
I agree with both of the previous speakers. And with regard to development costs, I think as a legislature, we can improve the affordability of houses by getting rid of a lot of regulations that we currently have. The estimates that the Home Builders Association currently have for development is we've got approximately $94,000 in new home construction that is just attributed to regulation. That's almost $100,000 that has to come out of somebody's pocket to try and move or build a new house. So on my committee, my joint committee on administrative rules, we're trying to eliminate a lot of those regulations and make it easier for developers to put in affordable housing where it's needed. Now in Macomb County, we also have, by the way, specifically in our prosecutor's office, a senior department that looks at senior issues and senior scams. There was a percentage that we looked at as to and Senator Irwin touched on this, the sale of a senior's house without their knowledge or done by a relative or someone that doesn't have good intention. Actually, I think it's about 63% of the bad guys out there that are family members that take advantage of the senior's assets. The senior, by the way, a lot of times will look at their family member and be afraid to report what is going on because it is a family member and they don't want to get involved with the court system, which is really unfortunate. So we have to make sure that seniors understand that they shouldn't stay quiet, that if something's going on with their family, it should be reported so that we can have some oversight in that.
And I agree with all the legislators. I wanted to just kind of note, as chair of Leo and overseeing a little bit of MISHA, we've been making a little bit more investments and trying to be creative on how we can support seniors. I think as I said before, is either staying in their homes with either home repair. I know we have environmental repair grants that can help them redo their windows and save a little bit on those energy repairs. But also trying to be creative with what other states are doing. And that is, I love this question because as I was working on housing incentives and how to be supportive, I was talking to a lot of seniors that are saying, you know, that is what is keeping me, and the increase in taxes and kind of that stepping down or stepping out approach. And so we're looking at other states to figure out how we can be supportive around that, either it being certain amount of years or even a step down approach. But we are seeing this being a huge problem as to why seniors aren't leaving the homes that might be a little bit more harder to live in. I know I bought my first home from an aging out senior that wanted a smaller place that had 3 stories, and she didn't have a bathroom on the main level. And so it took her almost 10 years to leave because she couldn't find the money affordable to downsize. And so that is something I'm very much looking into and would really like to share when we find some options, either appropriation or policy side. But that is a huge problem that Michiganders are experiencing. And I do know that the Senate, at least in the appropriation, is really trying to work on avenues right now so they can feel supported, but also a long-term ability and pathway for that.
Before we close out, I do want to just follow up on what the Senate is doing, but also asking the question of how can legislators reach across the aisle to have conversations with each other that might have conflicting ways on how you guys get to the same solution, but can work together to get to that solution. And what kinds of things are each of you guys doing in order to make sure that you're reaching across the aisle to work with your colleagues across all political spectrums?
If I can start again, I just passed we're calling them Taylor Swift bills. They're going against bots that buy up a bunch of bills, buy a bunch of tickets before people can access them, and they also charge like 10 times the amount. And that I'm mentioning because I was working with Senator DeMoose, a Republican, and we were able to get almost all, I think, but one senator, and so that's bipartisan. And I think it's just not only conversations like these, it's stakeholders that bring us together in ways that we have common areas, but it's also having access. I think it's being open and honest. And I think it's a lot of just making sure that, again, stakeholders bring us together and fight for what is important. And as I heard today, regardless of Democrat or Republican, we share a lot of common issues and we want a common solution. So I'm very hopeful for that, and know that at least on the Senate side, it's a little less political as I experience. So we're able to work together. And I have seen on the House side just a commonality of things that affect all Michiganders, regardless of where you're at.
I think we work across the aisle a lot more than what you hear about, because you always hear about how we can't get along at all. But no, we do our the guardianship bills I talked about is bipartisan. She just talked about the Taylor Swift bills. Yes, those are bipartisan. We have a lot of bipartisan issues that we work on. The TRICARE for our National Guard that Representative Wozniak was talking about. That's my bill. That is bipartisan too, as far as co-sponsors. So yes, we do work across the aisle quite a bit, a lot more than you hear of.
Thank you guys both.
It's never as
yes,
exciting for
Senator
the
Irwin.
media when we're getting along. It's never as exciting for the media. They like the content.
Yeah.
Sure.
That is very true. Well, we are at time for today, so I want to thank all of our legislators for joining us for this state legislative conversation on flipping the script on aging. We did cover a wide range of topics, and I do want to encourage all of our participants that are here to please, if you have further questions, please reach out to your representatives, whether through social media or whatever, to ask your questions. Their teams are very robust and knowledgeable and are happy to work with you guys. And also, please stay tuned. Ageways will be hosting a federal legislative conversation, hopefully sometime in August, where we will be addressing some of the federal changes that are coming down the pipeline. So thank you again to all of our legislators, and have a great day, everybody.
Thank you.
Thank
Thank
you,
you.
everyone.